It is the Front Page Saturday Town Hall edition. Big shout out to the great Roland Bynum for sharing his time with us this morning. And of course, Guy Black for sharing his time as well. He's coming up after this with his Battle Royale. Also, we've got the KJLH Men's Empowerment Summit today. Yes, it is today at 10 o'clock at kjlhradio.com. We've got financial summits about how to build wealth. We have a social justice panel with Senator Steve Bradford, and of course the relationship negotiations panel with Kevin Nash. Keynote speaker D.L. Hughley. It is going to be quite a day. You could get it at 10 o'clock live at kjlhradio.com, or you can get it on demand anytime you want on our website. Okay. We've got a lot to cover. We've got some great guests to help us do just that. And I'd love to hear from you. 520-KJLH, 520-5554. That's the number to call, no matter what your area code is. Joining us now, he's been a member of the fire department for the past 33 years. He's presently an inspector in the Fire Prevention Bureau, but he's been a public safety rescue driver and also a member of the LA City Stentorians. He was awarded the Medal of Merit. Ooh, that's impressive. For actions during a water rescue effort with a submerged vehicle and a person trapped inside, and recently got a special commendation for rescue efforts in 2016. It is so great to have you on the show this morning, Gerald Durant. Welcome.
Well, thank you for having me. I appreciate it.
Busy times, rough times in your line of work right now, right? Because just with the pandemic, people getting sick, our emergency rooms, I understand, are now at 13% the ICU capacity, meaning starting tomorrow, we're going back into a stay-at-home order.
Yes, and stay at home as much as you can. Go out for essential stuff. Wash your hands. Wear your mask. And actually, when you're out shopping, you know how we like to touch stuff and read the labels. Wear your gloves if you're going to do that. That kind of keeps everything together. And then dispose of your gloves. Keep that hand sanitizer, and you're going to be good. But no nightclubs, no big partying. You'll be fine.
It's Radio Free 102.3 KJLH, Compton, Los Angeles, Long Beach, and Inglewood. We've got people with a lot of knowledge on this panel right now. So if you have a question, a worry, or, you're not believing what you're hearing, don't ask me, ask them. In fact, ask Nurse Alice. Alice Benjamin is joining us. She's a cardiac clinical nurse specialist, a family nurse practitioner, ICU, and ER nurse with over 20 years of experience. She's also a medical correspondent for NBC LA. She's been on Dr. Oz, The Doctors, Dr. Drew, and more. Nurse Alice Benjamin, welcome back to the Front Page.
Hi, good morning, everyone. I'm excited to be here, and I got a lot to talk about because you know what? I worked last night. I took care of people with COVID. So I'm ready to answer some questions. I really am.
Wow. Okay, so one of the questions that we didn't, the Dr. Hosea Nelson, he's a chemist, right? He's, not on the front lines, but was able to answer a lot of questions about the vaccines and the science behind it. But on the ground, DA asked the question about, we're not seeing the spread among the homeless population in LA. From what I'm reading, the homeless population so far has been pretty protected, and that's making him skeptical that the virus is even real, because he's saying, homeless people don't have the ability to wash their hands all the time. They're not wearing masks. So if they're not getting sick, this must be BS. Do you want to take that on, Nurse Alice?
Well, what I'll say is I've actually not seen too much data on the homeless and contracting COVID-19. My experience has been actually working in the emergency room is that a lot of people who are homeless, who don't have access to health care or a regular provider, do use the emergency room when they are sick. I'm not seeing a big number of homeless people with COVID-19, but I will say that I have seen cases of people who do have it. So, but I'm not clear on the stats yet, but I would be more concerned for them maybe they're just flying under the radar right now. We've just not been able to collect that data because, as we know, homeless people kind of move about, and it's difficult to track them. They're not coming in to always report things. So I would be a little skeptical to say that because they don't have access to clean, hot, running water. And the sanitation isn't always available to them. So I'm really not sure exactly what the numbers are, but I wouldn't say that they don't have it, like they're exempt from it, like they're immune. I wouldn't say that. And I will say this, COVID is real. I promise you it's real. I promise you with all of the patients that I've taken care of last night, intubated, having problems breathing, really suffering at this time. People really do have COVID. And the thing is, the public doesn't get to see what I see. And obviously for HIPAA reasons, right? They can't just flash people up on the television and in the news and things like that. All they can do is get people who are willing to tell their stories. But by the time they're willing to tell their stories, they're well enough or have recovered. But until you can see what I see, when someone can only speak one or two words because they're so short of breath, then you'll realize that COVID is real.
Would you like to add to that, Mr. Durant?
Sure.
Yeah, because there is a lot of skepticism.
I think what happens is people don't understand, if they have not been homeless before and out there, it's a different world. Some of those, even though we have mobile testing sites that go sometimes in locations where you have people living on the street, urban campers, we find that all of them don't want to take tests. And then how do they get the results of their tests to see if they're negative or positive? Do they have cell phones? Do they have the other means of understanding or getting the knowledge of whether they're infected or not? Homeless, they do kind of move around and stay around. They all don't want to be tested. They don't want to be around some people themselves, and some keep pretty isolated. So,
which is maybe another reason why, if it isn't spreading, that it's not, is you don't see, houseless people hanging out at parties in Hollywood Hills, or standing next to people with no masks. For the most part, they are pretty isolated.
Plus, they have their own strains of diseases and colds and things like that are different than those folks that, are able to live a semi-normal life. It's different on the street for them, definitely.
Okay, let's go to Pedro. He's been patient. Thank you for waiting, Pedro. You're on with Nurse Alice and Gerald Durant. Pedro, you there? Okay, I guess we've lost Pedro. We've got Amin calling us from L.A. Good morning, Amin.
Yeah, good morning. Yeah, I wanted to ask about the homeless population, too, because every single day they have to eat. They have to go to McDonald's, Burger King, whatever. They go to Safeway, Ralph, every day. You know what I mean? And
do they? A lot of them, if they have money.
If they have, but they're not going to. They got to eat somewhere, right? They got to eat somewhere, right? So, that's my point. They are in the population. We've spent around $3 trillion since this COVID thing hit. A trillion seconds is 32,000 years.
Right. Okay. So your bottom line, because we are on a tighter timeline on Saturdays. Yeah.
In other words.
But I don't understand what is your point about the homeless? Is that making you think that COVID isn't real? Are you making a different point?
Right. It makes it, if they're not dealing with this homeless situation, it seems so hypocritical and so counterintuitive. How can you say you're fighting COVID and you got all these draconian measures to so-called.
Are they draconian, though, really? Is it draconian to wear a mask and keep your butt at home when you could kill people by making them sick or kill yourself? To me, that's just not draconian. I don't know.
It would be more logical, to deal with this, this helpless homelessness.
Yeah, no, okay, so let's have the panel address that, because that is a really good point. We're not dealing with the homeless population with COVID. And also, for those who are skeptical, look what's happening inside the prisons, where it is multiplying at scary rates. Gerald, you want to take this on? He's very skeptical, and I don't think he's the only one thinking this way.
Well, I think us that don't really work in the homeless areas where we have people that are homeless don't really understand their plight as well. I think they have multiple things that they have to worry about or are concerned about surviving every single day. It's hard to really put a finger on what's going on with the homeless unless you're out there with them every single day. Some of them, if they have a campsite where they are and they get moved out for a day and go to the hospital, when they come back, that campsite or wherever they were staying is gone. It's one of those you move, you lose type things. And it's all over. You can see it under the freeway passes and things like that. When the COVID testing vans come out there, they're able to get a test. And it's just hard to track them because they're always on the go. And plus, they don't always want to talk to people who are walking up to them because they don't know what those people are bringing towards them. So
right.
You have to continue to work on every single day.
Nurse Alice, I also think he was talking about if houseless people are not, able to wash their hands and such, and then they're in the grocery store, and then we go in the grocery store, wouldn't they be spreading the virus as well?
It's a possibility. That's why I say you have to make sure you wear your gloves when you're going to start touching items.
Right.
Okay, go ahead, Nurse Alice.
You have to think about how the virus is spread. It's spread by droplets. So that's why, we typically tell people at least 6 feet of social distance. So if someone's coughing, laughing, singing, whatever, and those droplets come out of their nose and their mouth, it has the potential to spread to you. So can coronavirus live on inanimate objects? It can for a short period of time. I don't have those numbers memorized as far how long, but they don't live forever on these inanimate objects. The virus will die. It does need a host per se to survive. So you really got to think about how it's contracted. The more common way that people get it is from that close contact, being around someone, sharing a cup, coughing, someone around them, talking to them, not wearing a mask. That's where a majority of the transmission happens, when those droplets get into your eyes, into your nose, into your mouth. Can you get it from touching an inanimate object, maybe that was with fresh coronavirus droplets on it? You could, but it has to be within a typical time frame. And if you're doing good hand washing and good hand sanitizing, it's very unlikely for that to happen.
We have an anonymous caller on line 1. Good morning.
Hi, good morning.
Go ahead.
Oh, hi. I currently have coronavirus, and prior to me getting it or coming in contact with it 2 weeks ago, I was around someone who was coughing quite a bit. And after that, a few days later, about 4 days later after Thanksgiving, I got it. I lost my sense of taste and smell. But this person is claiming they don't have it. And I know I had just had a negative test that the week before had been around anyone else. And,
wow. I'm sorry to hear that, by the way. So what was your question? That's such a nightmare.
I guess the question is that possible that their test could be negative?
Well, I mean, I'm going to let, our experts respond, but Dr. Hosea Nelson, a world-renowned chemist, just told us that false negatives are part of the calculus. So something like 5% of those tests are going to be false negatives. False positives are very, very, very much less likely, is what he said. But false negatives are a thing. So yes, I would say it is possible. Nurse Alice, you want to take that? Oh, Gerald, go ahead.
Yes. So what we know is that after exposure, you can develop symptoms anywhere from 2 to 14 days. A majority of people will develop their symptoms anywhere between 5 and 8 days after the exposure. So I know you said you were around someone who was coughing, and very well it could be them. If they tested negative, that's a possibility. But I also want you to think about, did you go anywhere else? Did you go to a grocery store? Were you in the post office? Because there is 20% of people who are COVID positive are asymptomatic as well. So I know you're thinking of the coughing person, but you very well also could have come in contact with someone who was positive, but who was asymptomatic. I know it stinks because you're like, let me do this math. I got to calculate and think back. And, that's one thing that I tell people now, to be more conscious and aware of your surroundings and where you're going. Because if you test positive, we're going to ask you a lot of these questions. And that's what makes tracing so difficult, because we're asking you for all this recall. But, it could be very well that they have a false negative. And then also, I want you to think about who else you may have come in contact with, because it's possible you might have been around someone who could have been asymptomatic but still positive.
Right, and let's remember it's not just coughing, laughing,
yes,
singing, yelling, even talking too close.
Yes.
Gerald, Durant, a lot of people are now saying, well, they're inflating the numbers of COVID-19. This is one of the things that we hear people saying a lot, that deaths are being attributed to the coronavirus, that were people that really died from something else in order to make it seem worse than it is. What can you say to people that are worried about that?
I don't believe everything you hear. Protect yourself. Make sure you wear your mask and your gloves. Clean your hands. Stay away from people. Get your distance. I mean, we're human beings. We like to be close to people. We like to have that close conversation.
One moment.
But now you have to step away. There's so much out there. No one can really, the regular public like ourselves. We hear different things. You have to set your standard of how you're going to take care of yourself. And the numbers are not inflated for, people are trying to calculate. I don't think the numbers are inflated. I think you have to be very careful. Matter of fact, I think the numbers are underserved in one kind of a sense. There's probably more people walking around with COVID than we actually know.
Well, when they say understated, they're talking about deaths. And maybe you can talk about this too, Nurse Alice, because people are saying, well, doctors are getting paid money if the people die from COVID. So, someone could be dying from cancer and they're just going to say it's COVID because the hospitals make money that way. That's what we hear.
Right. So that's a good question, and I can see how people can think that. But this is what happens, and this is why we say people who have comorbidities or other conditions are at higher risk for complications. So, Dominique, if you have heart disease and then you acquire the coronavirus, develop COVID, that inflammation and that infectious disease process will accelerate any type of disease problem that you have. So if you are already kind of on the, cusp of clogged arteries, close to having a heart attack, maybe that was kind of down the line if you didn't change your lifestyle, that coronavirus can actually trigger you to have that heart attack now. So when it's in the unfortunate event that someone dies, you don't say that they necessarily died of the heart attack, but the heart attack was a result of the coronavirus, which then exacerbated their pre-existing condition. So that's why the numbers are being attributed to COVID. It's the underlying condition that accelerated the heart attack, or accelerated the sepsis, accelerated the pneumonia that caused you, that caused you to die. Yes, maybe the person had a massive heart attack, but it was because of the coronavirus that stimulated and kicked off that inflammatory infectious disease process. So that's why they attribute it to COVID.
And by the way, family, the stay-at-home order is back as of tomorrow because our ICU capacity has dropped to 13% right now. So it's real. I mean, we'll talk more about that. If you have questions about that, I have a couple. What are the restrictions exactly this time around? Also, Gerald Durant is with us. He's a member of the LA City Fire Department for 33 years. Nurse Alice Benjamin, nurse in the ICU, in, the emergency rooms, and dealing with this on the ground. So if you have questions, you want to talk to credible Black experts, you can do that right now. It is the Front Page Saturday Town Hall Edition, broadcasting live from the 1-800 The Law 2 studio, Radio Free 102.3 KJLA.